Hello, my name is Diana McNeil, and I am one of the co-directors of the Professionalism Accountability Program. And I want to share with you a general overview as we welcome you to our Duke community. Professionalism has many definitions, but certainly for all of us who have entered our health professions field, we accept that professionalism is part of our responsibility to our patients, to our colleagues, and to each other. Professionalism has been defined as the skill, good judgment, and polite behavior that is expected from a person who is trained to do a job well. And at Duke, professionalism is part of our mantra. And as you walk around Duke, as you join our community, you'll see this sentence over and over again, that caring for our patients, their loved ones, and each other is part of our professional responsibility. And we do this through teamwork, integrity, diversity, excellence, and safety. Professionalism is often self-regulated. Professionalism involves effective communication, technical and cognitive competence, teamwork, and we need to model this as we are teaching our learners and helping others learn to manage our patients with us. It also involves being available. So you can see that in the broad spectrum of all the work that we do as health professionals, that professionalism is the underpinning for all of our activities. Now, every once in a while, professionalism can come under some question. And there's many papers that describe the effect of professionalism on patient care, morale, retention of employees, and also personal self-worth. I don't need to read this paper to you, but just read that rudeness in a medical setting could kill a patient. And so we at Duke, as part of our goal to encourage and support excellent professional behavior, really want to make sure that we don't have events like this occurring, that we don't have events that rattle our interprofessional teams or cause people to be afraid to admit a mistake or to share with one another a new way to manage a patient, an event, a ward, whatever you're going to be involved in. So because of this, we want you to be understanding that we have a process at Duke that we have borrowed from Vanderbilt that helps address this disruptive behavior. So for a moment, I want you to think about your past experiences. I'm hopeful that your new experiences at Duke will not involve a positive answer to these questions. But in the last month at work, have you experienced someone who raised their voice in anger to you? Someone who belittled a decision or action without a conversation? Someone who offered an inappropriate comment, joke? Someone who was rude to you? Or did you ever avoid talking to someone because you knew it was going to be a negative interaction? These are all disruptive behaviors that we don't want to have at Duke or anywhere else, actually. And so if you answered yes to any of these questions, then we're hopeful that some of the things that we're going to mention in a minute may be of benefit to you. So when you have behaviors like this behavior is not consistent with our commitment to respect and dignity for our patients, our families, or each other. And we all did take the oath to be professionals in our environment. So right now you're thinking, well, maybe I have experienced this, but there's probably some good reasons why this disruptive behavior occurs. Maybe you thought that people do this when they're tired or frustrated. And certainly under our current pandemic, which I'm hoping that if some of you are watching this in a few months, that we have a different environment, there's much frustration about some of the many changes and the ambiguous losses that are occurring in our current environment. Sometimes we feel production pressure. You all are being welcome to Duke, and I want to encourage you to recognize that a lot of times the production pressure we put on ourselves are self-mediated, and that we need to take a deep breath and make sure that what we are perceiving as production pressure is real. Sometimes the lack of autonomy, the lack of a voice, the lack of control. And as future leaders or current leaders in our institution, I'd like to challenge you to be aware of that lack of voice and lack of control in some of the people that you might be working with, and try to include them in any kind of decisions or actions that might be part of your team. And most importantly, health providers can act out if they see their leaders or others role modeling behavior that is tolerated or acceptable. I want to challenge all of us to role model the opposite direction. Role model excellent professionalism and excellent listening as a member of your team. And we know that the consequences of this unsafe behavior from a patient's perspective can be quite important for us to recognize. Always we worry about things like lawsuits or non-adherence or non-compliance by our patients. But we also worry about complications, infections, errors, and certainly the cost of unsafe practices that may have occurred because people won't discuss a new idea or a better way to do something. But there also are consequences of unsafe behavior for the healthcare professional. And certainly harassment lawsuits are something we worry about. But we also talk a lot right now about burnout, about a lack of enthusiasm and passion. This can sometimes lead to mistakes or even a desire not to remain where you are. And I really don't want to say that to all of you as we're welcoming you into our community. We want you to stay at Duke for a long time. And then there's this interesting word, jousting. I don't know how many of you look at fencing as a sport, but if you see people that fence with their swords, they stab and stab and stab. And I'm not good at knowing the rules of jousting and fencing, but I suspect that there is some benefit to doing that. But there's certainly no benefit to jousting a colleague, continuing to make comments that can undermine their confidence or their decisions or their thinking. And certainly when we have unsafe behavior, this can make our organization not function effectively and really have a negative impact on morale. So let's talk about what we're going to do about this at Duke and what we do about it. Dr. Jerry Hickson and his team came up several years ago, and please note the date on this article is 2002, with an interesting idea to offer what we call Cups of Coffee, a peer messenger program that allows trained peers to reflect with a colleague who's had an unprofessional, non-egregious, it's important to note this, non-egregious misstep. And this intervention model promoted accountability and actually was shown to decrease the number of professionalism concerns that were occurring at Vanderbilt. So a few years ago, my colleagues, Dr. Bill Richardson, who's one of our orthopedic surgeons, and Cindy Gordon, who works in our patient safety and quality area and is a registered nurse par excellence, started a program that I was honored to join a few years ago called the Cup of Coffee program, where we train colleagues who volunteer or who have been nominated by their leaders to develop communication techniques as peer messengers so that when some member of our family or community has a professionalism lapse, we can send this peer messenger to briefly discuss it with them and help them realize that this was not in keeping with some of the initial or permanent expectations of being a professional at Duke. And this works. This works. In this article by Dr. Hickson, he pointed out that when you have some of these concerns, it's not all physicians who are involved. In fact, it's a very small number of physicians. As I'll show you in a minute, the data at Duke suggests that less than 10% of all of our health providers who are physicians, because right now this program is done predominantly for faculty who are MDs, only 10% ever get a cup of coffee. And of that number, very few have a repeat event. But when we do decrease professionalism issues, it can not only improve patient care, but it can decrease malpractice claims and costs, which is also important to the institution. So this program provides a framework for ensuring physicians and soon other healthcare providers are consistently exhibiting the behaviors that I mentioned at the beginning, caring for our patients, their loved ones, each other, with teamwork, integrity, diversity, excellence, and safety. The objectives of the program are to completely support the core values of Duke Health, which is now where you all are joining. It's to improve communication and efficiency of the healthcare team, take excellent care of our patients at the highest level, and reduce medical malpractice risks. Now you may say, so where do we get the data from? We have a system at Duke called the Safety Reporting System. It is on many of our computers. And on this system, you can report a medication error. I'm an endocrinologist, and so we are very often reporting any type of insulin issues. You can report a safety issue that you noted, or you can report a professionalism issue. And this report gets sent to Cindy Gordon and our office and is reviewed by our team. And then, if appropriate, we ask one of our peer messengers, trained peer messengers, to go and have a cup of coffee, figuratively right now because most of our conversations are virtual at this moment, with the person who had the lapse in behavior. These comments that come through the SRS are confidential. And we do send a note back if we have the reporter's name that the PAC program is addressing the issue, but we don't give any other details. We do allow other reports on the safety reporting system, as you can see on here, including anything that involves a lack of respect, a lack of accessibility, meaning someone didn't answer their page, or availability. And then sometimes we get other concerns directly related to professionalism, either through the School of Medicine, through patient satisfaction data, or reports directly submitted by email. The School of Medicine addresses learner and resident complaints directly. We directly take care of faculty complaints. And most recently, we've been developing some training for our colleagues in the School of Nursing, in the PT program, in the OT program. And these kinds of conversation that we train you to give could even be used in your homes with your families under certain circumstances. The cup of coffee occurs, and we have a document that we keep of a list of all the events, but that's where it stops, at least for the first cup of coffee. But if someone has a repeat event, that is not egregious. And I want to just keep saying, please note on this slide that the word egregious is in red. And if someone has a sexual harassment event, a felony type behavior, something that's really very serious, it doesn't go through a cup of coffee. It goes right to an authority intervention with either the chairman, the chief medical officer, division chief, or all of the above. The PACT program addresses the cup of coffee, and if there's a repeat complaint, we send the same peer messenger, if possible, to have what we call an espresso. A recognition that you've already had one concern raised. What's going on that's causing you to have continued difficulty in the professionalism arena? I want to emphasize that these peer messengers are not sent to solve the problem, but they do have resources that can be given to the person who is being told that they have a professionalism lapse, so that they can get help if they need it. And most of these interactions are remarkably short. They are not hour-long conversations, and we try to do them at least until we had issues with physical distancing in person. We do send an email, as I mentioned, to the reporter, and please note the second paragraph, because this is important. It's important both to the peer messenger as well as to the person receiving it. Due to confidentiality, you will not receive any information on the actions taken as a result of the report. But we do want you to know that we're addressing it. And that full circle of letting know that we are addressing it is really important. So in the past, we know these peer interventions work. Most of the concerns that we get are related to inconsiderate, rude, or inappropriate comments that count for 68% of the reports. Failure to collaborate account for another 20%. But you're just being welcome to Duke. Why are we sharing this with you? Because we don't expect that you will ever have a cup of coffee. In fact, 90% of our Duke physicians never receive a report. But of those who do, 70% of those do not have another event. They don't have the espresso. But we want you to know how important professional behavior is to the culture of Duke. And know that if for some reason you see something that isn't professional, that you have a resource. So one of the other things that we have included in our conversations are different ways to manage stress and increase resilience. How important is that now? And on this list, which I'm not going to read to you in detail, but I would encourage you to quickly read it and maybe pick out 2 or 3 that you want to incorporate into your day. On this list are a number of things that we want to encourage our faculty and staff to do on a regular basis, particularly during challenging times. And we have many resources at Duke that can continue to help all of us manage any stresses and increase our resilience. I want to leave you with a couple resources. We do offer Team Steps training. We do offer PAC training, and I would be excited if some of you thought that you would love to be trained as a peer messenger. We have a number of well-being resources, and we also have various types of quality and safety courses throughout the year. Most of them right now virtually given, so that maybe you can participate in them. We have, again, many resources, and again, we are so pleased to have you here at Duke. All of us, Dr. Richardson, myself, Cindy, Gordon, would be thrilled to be a resource for you. And again, I want to share with everyone else a welcome at Duke. You will enjoy working here tremendously, and we will enjoy having you with us. Take care.